My belief is a patient really needs to know exactly what their situation is in medicine, and they're constantly researching. They know as much about the widowmaker as I do sometimes. We've had a long experience with coronary CTA. The problem was that the presence of disease created all sorts of questions. It's hard to take a plaque in an artery, especially if there's a lot of calcium, and really know for sure whether it's a narrowed artery or not. The big concern with coronary CTA was the belief that it would increase unnecessary invasive testing. FFR in the cath lab has become a necessity really to evaluate coronary artery disease that we can't otherwise assess. The major change now has been the availability of the HeartFlow analysis. We can now take an area of narrowing that we might have questions about, send it to HeartFlow, and have them analyze the artery and tell us whether there's a significant blockage or not. And that actually has changed everything.
We've been with HeartFlow for about a year. The people from HeartFlow were here. They spent the day with me as I was doing coronaries. They showed me how to use it, when to use it. All those things together give you a really clear picture of those coronary arteries.
Any good cardiology practice, prevention is really the key. And what I see is the ability to most accurately identify who has coronary disease. People that have HeartFlow analysis permits us to determine who needs to go onto the cath lab and get a stent, and who does not require invasive study and can be treated medically, and hopefully prevent that point at which an invasive study and stenting is required. So it's reassuring to them to be able to tell them that this is the plaque, this is the degree of narrowing, and this is our game plan.